So, okay, we were speaking before about, you played me something just a minute ago before we were setting up all the cameras and stuff. And you were playing me an interview that you did recently.
Yes.
What are you aware of about your voice?
I noticed that it's...
Thank you for the coffee, by the way.
Cheers. Cheers.
Cheers. Cheers, everyone.
Cheers.
Cheers. Salute.
So I noticed that I don't have, that it feels a little bit weak at times, and I'm not always super clear, especially when I'm tired.
Yeah.
So some of the words sort of disappear a little bit.
Okay. So what I noticed is it feels to me that your tongue may be a little bit tight.
Yes.
So you want to release the tension a little bit, and maybe in your jaw. So there's a couple of things. I mean, actually, massaging. Take my glasses off because I don't know why. But I'm going to give it a go. Put your coffee down. Are you up for doing a bit of this?
Sure.
Is that okay? All right, fantastic. Right. So, if you with your knuckles, just
looks a bit scary.
Yeah. It's a bit weird because I can't really show you, but we're just going to put our knuckles just underneath the cheekbones. Okay. And we're just going to massage that as well, because this is where a lot of the tension is here, and it might hurt a little bit. I don't want to.
It does hurt a tiny bit.
So if as you're doing, in fact, put 2 fingers up here, and slight pressure, and it will hurt a little bit. And if you open your mouth slowly, with the pressure, you'll find there's a bit of pain, but no pain, no gain. So don't hurt yourself a lot.
No.
But that is a really good.
Wow.
Can you feel it? So that's just releasing the jaw a little bit. Can you feel the difference?
Yeah.
Afterwards, so straight away, think about chewing. Okay. So if you're, and then make a sound. Do the same thing with your mouth slightly open. Perfect. Now say something. It could be anything you like. So, you can try into saying something, doesn't matter what it is, and keep chewing.
What?
Yeah. Yeah.
It's really hard.
Yeah, it's hard to do. I can come. This is really nice coffee. Thank you very much. Now do the same thing again. Do it, and then straight afterwards say exactly what you just said, but normally. Okay.
All right.
So do the chewing first with the mouth closed. Really move the tongue and the mouth. And think about this pressure here, energy here. Yeah. Yeah. Feel it all. In fact, stick your fingers in your ears, and you'll be able to hear the resonance. How does that feel? Yeah. You can feel the extremities of that off the range and the pitch. When you put, you can't hear this, by the way, but you need to put your fingers in your ears to hear, not to hear what we're doing, but to hear what you're doing. Good. So do it again without your fingers in your ears, but this time, and then open your mouth slightly, and say something while you're chewing.
It's
It's strange, isn't it?
Yes.
Yeah. And then do the same thing again, but then straight afterwards say it just normally. Okay. So do this with the chewing. And then say
what happens in Vegas stays in Vegas.
Good. Yeah. So you need to do it a few times, a couple of minutes a day.
Yeah.
You're just basically freeing your jaw, freeing the tongue. Another one to do is if you put your knuckle in between your teeth, like that, and then there's a couple of exercises. So first exercise is you're using the articulators, so the tongue, the teeth, the lips, and duh gut duh gut duh gut. So dagga 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 dagga. Good. And again.
Dagga 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 dagga.
Yeah. Dagga 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 dagga. Another one. Ilia ilia ilia. Ilia, 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 Ilia. Good. Good. And then gla. Yeah. Don't bite. Yeah. Gla. Yeah. So knuckle. Good. And then say something, however, whatever happens in Vegas stays in Vegas. Yeah, say that now.
Whatever happens in Vegas stays in Vegas.
Good. Excellent. So it's just really opening that oral cavity, and freeing the tongue and the jaw here. The other one is your larynx is but it's connected here through the vocal tract up to the jaw, and there's two main muscles here in the side of the neck.
The sternocleidomastoid.
How do you know that?
I know things.
Yeah. I wasn't gonna. I thought that would just be too geeky to talk about, and I thought I'm not going to mention that muscle, but you've mentioned it. Say that again.
Sternocleidomastoid.
Fantastic.
Yes.
That's incredible. Amazing.
I have a background in bodywork.
Perfect.
And what I'm noticing is that my face is tingling now because I've worked it.
Yep.
It feels like a tingling, and without getting too much into technical stuff, I think as a trauma therapist, I think a lot of people hold a lot of tension, sort of emotional tension and stuff as well. And I think I mentioned to you that some of the tension I think I hold is because I've had various accidents where I've had like an impact to the face. So, and I think those things can stay. They can stay in the body unless they're discharged, basically. And this is what you're helping me.
Absolutely. Absolutely.
Yeah.
So just really finding that those two muscles here, and then just massaging it slow, because they'll go all the way down from your ears down to the neck, right at the bottom of the neck.
Yeah.
And just kind of freeing that up here. So that, you want to spend a few minutes doing this, it might just be in the office or,
on the tube
or anywhere really. And it doesn't look that weird, does it?
No, it doesn't look that weird.
The raspberry looks a bit weird, or the chewing. But actually, any of those, the chewing, just this is a really good. This one here is really good. I find just to get opening up that area. A lot of us, before I sing, I'm a singer. That's how we met, isn't it? But getting everything open and moving everything around here, around the oral cavity and around the area here, which is the mask, and just getting that together. So the other thing is that this is a bit strange, but the larynx here, which is our voice box, the vocal folds incidentally are within the larynx, and you can if you can hold it, the thumb here, two fingers, and be careful, but it's okay. You can actually move it, and you'll feel. I don't know. I mean, I can hear that quite a little. You probably not. You can hear a click, or feel a click.
I can hear your click.
Yeah. You can move it quite dramatically.
Can you? If you hold,
try.
You're allowed to touch. Try.
Yeah.
Can you?
Yeah.
You can do it on
That's
me.
fine.
Like
bring neck down, head down slightly. Okay. Yeah. Now you relax here. There we go.
Oh.
Okay.
Now
It feels
clicking.
weird. It feels
Now
weird,
it's
doesn't it?
clicking.
Can you feel mine? Yeah, really go for it. It's a bit higher.
No.
That's it.
I can't hear it.
You got to get in there. Really grab it.
I can hear it. I've done mine now.
You feel yours. Yeah. It's weird. It's totally safe. By the way, to do it, but don't go crazy. But be careful. But
this is like loosening.
It's just loosening
vocal.
the larynx, the laryngeal area here. So this is where the vocal folds are. So just getting those, and there's a lot of cartilage and muscle in here, and just moving that ever so slightly. And actually, as you're talking, if you can, this is something we do as singing. So it's the same thing with singing and talking.
Oh, I've really got it moving now.
Yeah, and it needs to be really flexible. It needs to be because there's a lot of movement and muscle and air and cartilage that is resonating here. So the more flexible it is, the more resonance you'll have, and the freer it is, and the freer also the vocal folds are going to be able to stretch and tighten, so you can keep them in that position, and then your what we were talking about earlier, your range of your voice, she doesn't have the range. Your range will be wider and more flexible. So you're trying to make everything more flexible. Your jaw area, your tongue, your oral cavity, your voice box here, your throat, and then we could then go on talking about how the posture and how relaxed we are and etc. Which
and the breathing and all that.
Breathing and all that, yeah, which would be another video probably.
Yes.
Okay, so there's a few things there just to.
I feel kind of like more tingly and like looser already.
Great, fantastic.